So 7 series radiology, right? So in this, in your exam 10 will come. So what is mean by urography intravenous? What is the code urography intravenous?
74400.
74400. If it is bolus technique, urography bolus technique, what is the answer? Bolus means infusion, correct? Infusion technique.
74410.
74410. So urography IV means intravenous, then 74400. If it is infusion bolus technique means 74410. Another one we have. What is that code inside? If you are checking, you will come to know. What is that? Retrograde with or without KUB, right? So so urography, if they mention intravenous 74400. If they mention infusion or bolus technique 74410. If it is nephrotomography, then this code. Okay, in this one question it is coming in exam. Okay, so urography, please check what is the exact answer. Then second one we discussed hepatic artery catheterization. Common hepatic artery we discussed in 3 series. We have to go with the appendix L, then above the abdomen, below the abdomen, fourth character, fifth character we have to use. Along with that, they are using the any guidance from the 7 series. So here mentioned angiography. So the 3 series code along with 7 series code you can use, both you can report. That is the second one. Then third one is CT of the head without and with contrast. What is the code? CT of head without and with contrast.
70460 and 70450.
How many codes?
2 codes. Because first it is done with contrast and after that without contrast.
But it is actually it is without and with only. That is they are wrongly given.
70470, right?
So you have to go with only combo code. If both present, you can go with without followed by with only. Here I wrongly given, but in exam they will clearly without first used, and again they are using with contrast. So without followed by with contrast code only you have to use. 70470 is the correct answer. Okay. Then fetal transfusion, ultrasound guidance for fetal transfusion. Ultrasound guidance for fetal transfusion. Ultrasound guidance for fetal transfusion. This is also one of the repeated questions.
Yes, sir, it is correct only.
Okay, okay. Then next one is please go to this cardiac blood pool imaging. This code, everyone. Please go to this page 78483. 78483. 784. So page number 78483 515. Well, coming 515, here it is cardiac blood pool imaging first pass technique in single study means 78481. I said 78483. So this is for the cardiac blood pool imaging study first pass technique. If multiple means 78483. But this question is multiple only first pass technique. Okay. Suppose if they are asking gated equilibrium single study means you can look the same page. See, cardiac blood pool imaging study, gated equilibrium, single study. This. The single study means 78470. Multiple study means 78470. So this cardiac blood pool imaging study, one question it is coming. So please look this technique. First pass technique mentioned, multiple mentioned, you can go here. If first pass technique mentioned, but single study, not this code. If they mention gated equilibrium, single study this, multiple study this. Okay, in this is the one thing. Another one, myocardial perfusion imaging study. Here it is present. See, myocardial perfusion imaging study. Single study, so 7845152. These two codes, single study, multiple study is there. Myocardial perfusion imaging study. When we have to choose this one means, if they have mentioned word tomographic myocardial perfusion imaging study or SPECT word or attenuation correction. In this, any one word mentioned based on the single study, multiple study, you have to go 78451 or 52. Suppose in your question you not having this tomographic word or SPECT word or attenuation correction not present, then default is this 78453 and 54. 78453 and 54. It is the planner. Default is planner. Myocardial perfusion imaging study. After that, they mention SPECT, attenuation correction, or tomographic means 78451 or 52 based on the single or multiple study. If not mentioned, default is planner. Okay, here also one question it will come. Okay, then. Okay, so this is over. Then, what is the code for stereotactic radiation delivery up to 4 fractions? This is also no.
773.
Yes, yes. Tell me code.
Code is 77373.
77373. Yes. 77373. So 77373. Yes, this is correct answer. This is a repeated question also. So 77373 is the correct answer. Please make it note. Same question it is coming. Last week also came. Stereotactic body radiation therapy up to 4 fractions. Then it is the answer 77373 is the correct answer. Okay. So your answer 77373. The next. So next one is this one. So this one is, what is the question means? Ultrasound guidance for transrectal ultrasound, transrectal ultrasound, comma, prostate volume study for brachytherapy treatment planning. Ultrasound for transrectal with prostate volume study for brachytherapy treatment planning. That is the full question. Ultrasound for transrectal with prostate volume study for brachytherapy treatment planning. What is the correct code?
So the correct code is 76872. Ultrasound trans.
But I asked now ultrasound for transrectal prostate volume study with brachytherapy treatment planning.
Then it is
Then it's 7-3.
Okay.
yes, sir.
If a transrectal ultrasound alone mentioned, then 76872. Okay. So you have to look carefully here. So this is for this. Then when you will use modifier 26.
When the ultrasound or imaging is done by the ordering X-ray review and he has interpreted the report.
So physician provides interpretation and report of the radiological results or pathological results. Then we need to add modify 26. It is for the interpretation about that. It is not the someone interpretation or pathologist or radiologist interpretation or technician interpretation. Ordering MD ordered the chest X-ray. That chest X-ray taken by the radiologist. After the radiologist sending report back to the ordering MD. Now order MD looking the film by own. Then he is interpreting means. Then that is the interpretation and service. So radiological interpretation and service given. Then you can add modifier 26. So TC means technical component.
When the X-ray machine is taken outside pathology, outside the main place, and it is taken to a home or other facilities.
So we are reporting for the cost of the equipment. We are paying money to the cost of the equipment we are using, right? For that purpose, we are paying cost of the equipment or technician billing, or facility or hospital billing. So we are paying for not, we are billing to the not provider. We are billing to the facility, hospital, technician. Then we need to add modifier TC. Suppose that doctor is having own equipment. He is having own equipment and also he is doing the interpretation. Then what he will do?
We give both TC and
Then no
26
modifier.
both.
No
Yes,
modifier.
yes, no modifier. So he is having own equipment and he taken by X-ray taken by using own equipment. After that he is interpreting means so no modifier. So that code alone you have to do. If question they are asking how will you report the provider service? Means in the doctor what he done? He done only the interpretation 26. Is not is used interpretation and is the own equipment mean no modifier. Suppose question is how will you report the technician facility hospital means you can add modifier TC. So you have to know that clearly 26 TC. Okay. Chest X-ray AP, PA view. What is the answer? Chest X-ray AP, PA view. What is the answer? Chest X-ray AP, PA view.
Seven 1046.
Because AP is the what is mean by AP view?
Anterior
Anterior
posterior.
posterior.
That X-ray beam enters back of the body and exit front side, that is posterior anterior. The X-ray beam enters front of the body and exit back side, it is the AP view. Anterior, posterior, posterior, anterior. So two views this is. We have to take 71046 is the correct answer. Okay. Then X-ray of ankle, laterals, transverse view. What is the answer? X-ray of ankle, laterals, transverse view. X-ray of ankle, laterals, transverse view.
73620.
73610.
73610.
73600. Two views, right? Lateral and
I said
trans-
laterals, transverse view.
laterals. Okay. Okay.
Laterals, transverse view means it is the complete. Laterals already two, left side, right side. Then transverse, three views. So 73610 is the answer. Okay. Then, so laterals means two, transverse means one. If they mention lateral, transverse, then how many views? Lateral, transverse, how many views?
Then two.
Three.
Yeah,
Lateral, na? It's not S, right? It's not plural, right?
singular, singular.
Yeah, yeah. Then two views.
Yes, two views. Okay, the next question. Ultrasound for transplanted kidney with duplex Doppler documentation. Ultrasound for, take the question. Ultrasound for transplanted kidney. Ultrasound for transplanted kidney. Ultrasound for transplanted kidney with duplex Doppler documentation. Ultrasound for transplanted kidney with duplex Doppler documentation. What is the code? Without duplex Doppler documentation, what is the code?
76776 is with duplex Doppler effect, and without is 76775.
Yes.
Once again,
76775 without duplex.
with, without. Okay.
And with this 76776.
Yes, yes, yes. So if you are reading that with ultrasound 76776 below, you will come to know without duplex Doppler what is the answer. The next one is, what is the code for diagnostic mammogram? Unilateral. Diagnostic mammogram, unilateral.
77065.
77065. Okay. Bilateral.
77066.
Okay. Screening mammogram.
77067.
So, what is the difference between diagnostic mammogram and screening mammogram?
Diagnostic is when you have there is a suspicion that you have something, but for screening you have no symptoms and you're just going for checking if you have anything or not. So in screening it's default a bilateral code. We do not have to like add 50 modifier or anything. On the other hand, for diagnostic purposes we have a unilateral code and bilateral.
Okay. So symptoms present that time they are doing mammogram, then it is for
Diagnostic.
yes. No symptoms, then it is
Screening.
Screening.
yes. So you have to know this. That definitely it is coming one question. Diagnostic mammogram, unilateral, bilateral via in screening via only one code. So in that three code, one question it will come in your exam. Then now question I'm giving.
So I have one doubt.
Yes.
If suppose they are mentioning in the question with and without contrast,
Mm.
then what we have to be code?
Without and with, without followed by with contrast.
Yeah, that only na. If with also given and without also
Yeah,
given,
yeah.
then
Whatever they given can be combo only.
okay.
If one encounter it happened means like that you can do. So next one, DEXA with vertebral fracture assessment. Then another question, DEXA with bone density study. With bone density study. With, okay, what is the answer? I given two questions.
So for bone density study, it will go 77080, and for vertebrate one, it will go 77086.
Check once again.
DEXA with vertebra fracture assessment would be 77086, and DEXA bone density study with vertebral fracture, that would be 77085.
Yes, this is the correct answer. What she told, this is the correct answer.
I thought it's only bone
Bone
density.
density. Okay, okay. I coming here. This is very, very important. Most of the people are not taking correctly. Easy question. We will take 1 mark, but people are not following correctly. So if I'm saying DEXA with vertebral fracture assessment, then 77086. If bone density study and vertebral fracture assessment is there, then 77085. If you are coming here up to semicolon, here it will come. So DXA with bone density study with vertebral fracture assessment. So 77085. Bone density study with vertebral fracture assessment 77085. Only for the vertebral fracture assessment 77086. So this is the repeated questions. Okay. Then next, radiation oncology treatment planning and simulation for two separate areas. For two separate areas.
77262.
Only one code.
77262.
Only one code. Simulation. But spelling
No.
is simulation.
77285. 77262 and 77285.
So two codes you have to give, not only single code. Okay, so 77262 for the radiation treatment oncology planning. Radiation treatment planning, that one. And simulation code is 77285. So two codes you have to give. So how will you differentiate it is simple or intermediate or complex? What basis your
Depend on the area.
area? Yes, single area treated, simple. Two separate area treated, intermediate. Three separate area treated, complex. Okay, so you can follow that. Okay, now what is the code for Myocardial perfusion imaging study, tomographic multiple. Myocardial perfusion imaging study, tomographic multiple. What is the answer? Myocardial perfusion imaging study, tomographic multiple.
Can you repeat once again?
Seven,
I'm
78492.
78492. Myocardial perfusion imaging study, tomography multiple. Myocardial perfusion imaging study, tomographic multiple.
Seven eight four
Seven
five
four
two.
five.
78452.
Okay. Yes, 78452. So next one, thyroid imaging study. Thyroid imaging study. Thyroid imaging study,
78013.
78013. 78013. Yes. Yes, thyroid vascular flow imaging study. It is coming repeated question. 78013. Okay. Then what is the code description for 7559? Please check on 7559. This is also one of the repeated question. 7559. 7559.
Cardiac magnetic resonance imaging for morphology and function without contrast material with stress imaging.
Yeah, it is coming. It is coming. Repeated question. Last week also came this question. So please carefully handle. Yes. Cardiac magnetic resonance imaging for the morphology without contrast and with stress imaging. So this is the repeated question. Okay.
So we all would not be having the same paper. We'll get sets of paper.
Yes, yes, yes.
Okay.
Everyone will get different paper. Maybe
Sir, in examination will get audit tool also
no, audit tool they won't provide.
because sir there was like in mock test there was one question that stress test is done. So which level of MDM it will be coming? So
So we have to remember all the things. They won't provide audit tool.
okay, sir.
Okay. So next one is, so when we will consider what routes considered with contrast. Contrast material administering, right? So in which route considered the with contrast?
Intravenous.
Okay.
And IM, I guess.
IM.
Oral or nasal is not considered as contrast material.
Oral and
Nasal.
oral nasal. You forget everyone. Please tell what route considered with contrast, what route considered without contrast.
Intravascularly, intra-articularly, and intrathecally, oral and rectal. This will considered with contrast.
Oral and rectal.
With contrast, we will consider
No, those are without
intravascularly.
contrast.
No, this is with
Oral and rectal.
So wrong answers. Oral and rectal, the contrast material given, it is there without contrast. Without.
Without contrast.
Please remember carefully. This all I showed in a class. Again, I'm asking people are not saying correctly. What is this? Okay. That contrast material administered through oral and rectal, then it is for the without contrast. If the contrast material administered through intravascularly, intra-articularly, intrathecally, then with contrast. So with means intravascular, intra-articular, intrathecal. Without means oral and rectal. So we have to know clearly this. Okay. Okay. Then, so it is there in your book. If you forgot also, you can come to this starting of the 7 series. It is there. Okay. Please remember this. Mm. Appendicular bones, what are all? Appendicular bones, what are?
both upper and lower extremities.
Yes, yes. Okay. Radiation treatment management for 7 fractions. Radiation treatment management for 7 fractions.
77427. 77427. Yes, sir.
Yes,
5 or more fractions. It is 77427.
yes, yes. So 77427 is the answer. Okay. So this is for the